right? So that's called cryptogenic. Right? So that's the 5 main categories too. In the adult world, a lot of times there's a new category coming out called autoimmune epilepsy. It's more worked up more in the adult world, in maybe the teenagers, and that I group into cryptogenic, meaning something in the neurological history was not right, and therefore the patient now has epilepsy, but we can't identify it. Okay, sometimes we can, and sometimes we can't. Okay, so this does an overview, and in terms of what's causing it. Okay, and then in a way you want to know, because why do we want to know? Because as doctors, we want to know so we can help answer the next question, which is, am I having it forever? My parents ask me all the time, does this mean my kid's going to have seizures forever? Does this mean they're going to be on medications forever? What's the prognosis? Will he or she outgrow it? And the etiology, the reason why you have epilepsy is what's going to help answer that question to like, yes, and typically if this is the case, yes, you have a good chance of outgrowing it, or if this is the case, no, you don't. So prognosis is where it helps to understand what's causing your epilepsy. And then management-wise, that's a whole new talk. Like there's really 4 main ways to manage epilepsy, right? Because first okay, I've been diagnosed with this disorder. I understand what it is. I understand what type I have. Okay, you went into and did the workup in terms of what's causing me, why did I have it, what caused me to have epilepsy. And the next question is, how do you stop? How do you get it under control, right? And there's 4 mainstays of treatment for it. Okay, the first is medications. Right? The second is dietary therapy, like ketogenic diet. Who here went to the dietary talk yesterday? There's a ketogenic diet or dietary therapy where we can use different forms of change your diet in a way where it's high fat, low carb, low protein to help control seizures. There's neurostimulation, meaning it's kind of like a pacemaker. We send stimulation to the brain to prevent seizures. And the last category is surgery. Okay? So in terms of treatment and management for seizure, for epilepsy in these days, there's 4 main treatment modalities. Medications, dietary, neurostimulation, and surgery. Okay, so that's the next conversation you have with your doctor. And then the last conversation is like you typically ask, well, what are my chances of outgrowing it, my chance of being seizure-free? And that is something that's very customized to the patient, to the family. And something that I typically say, I need to know your child, I need to know my patient over time and see how the clinical course is going to have a better answer for that question. So that's a brief overview of what I call my roadmap already. I'll let my patients come into my clinic and say, okay, here is our roadmap for your journey on epilepsy. This is the type of seizure that you have, so you ask the doctor, I want to know my roadmap, right? The first thing is, what is a seizure? Understand what kind of seizures do you have. The second point on the roadmap is, what caused my seizure? The third on my roadmap, how do I stop my seizures? What are my choices? What are my what are you going to do to help me stop my seizures?
He has an incomplete hippocampus, and so they told me it's just, they put us with the neurologist for the epilepsy before he ever even had seizures.
Okay.
Because of that, is that something you think, like, it's a structural abnormality, but is that what we've been told his prognosis is, that it's just going to get worse as puberty kicks in, because that part of the brain is, his brain's going to start realizing that's lacking. Is that something, widespread? Because I've tried looking it up and I can't find anything on Google.
DrGoogle.com, right?
Yeah.
It's the best doctor in the world. So like I said, every patient's epilepsy story is unique. Everyone has their own unique story. No 2 stories are the same.
Yeah.
Even though I have 2 patients that may have the same structural abnormality, their response to my treatment therapy can vary. Right? So it's not something that can be widespread. Okay, in general, this is what's going to happen. It's very customized. Okay, it's depends on, number one, where it is, how has he responded, and a lot of times, in general speaking, when you have an area abnormality, say this area of the brain, there was too little folds, so it's called package iron.